All right, it is 7:30 in the morning. Liam Williams is a 65-year-old truck driver from Richmond, Kentucky. He has type 2 diabetes and is suffering from stage 2 colon cancer. Liam also needs his flu shot this season. The nursing assistant has taken a finger blood sugar on Liam and reports that it is 176. On assessment, the nurse can pinch less than 2 inches. See the healthcare provider orders. This is Liam Williams. All right, I have Liam Williams. Date of birth is 2/24/XXX. MR number is 002-47-1258. I'm going to go here and to compare it to my physician's orders here. I have William Williams, date of birth 2/24/XXX, 2/24/XXX. MR number 002-47-1258. 1258. He is 52 years old, 72 inches, and 85 kilograms. And I have no known drug allergies and no known drug allergies. So I'm going to go over here. We've got, today we are giving our flu vaccine, our influenza, Fluzone, 0.5 milliliters intramuscularly right now. And we are giving in the ventrogluteal site. We are also giving oxycodone, 10 milligrams, extended release, orally for 12 hours. And then we're giving insulin, Novolog injection for blood sugar as well. So I'm going to go head over here to my Pyxis, and I'm going to pull out, we're going to start at the top here. Influenza vaccine, multi-dose vial, Fluzone, 5 milliliters, I am now. Then I have Novolog insulin. What do we have here? So we just have multiples. Morphine. That's not it. Oxy. PO. That's this one. All right, so I have William Williams. Patient ID 002-47-1258. 1258. Patient I, or that was the patient ID, I'm sorry. Date of birth 2/24/XXX. Date of birth 2/24/XXX. No known drug allergies. I have got my materials gathered out of my Pyxis here. We're going to start here and do the influenza vaccine Fluzone, 0.5 milliliters IM now. And I have the influenza vaccine here. It is unopened, unexpired. Expiration date is 12/30/2050. 0.5 milliliters per dose. And then next I have my Novolog insulin. It is unopened, unexpired, and all intact here. 100 units per 1 milliliter, and that is per finger stick. It expires 12/30/2050. 2050, and I have oxycodone, OxyContin, 10 milligrams, extended release orally, 12 hours. And then I have oxycodone, OxyContin, 10 milligrams, extended release tablet. It expires 12/30/160. So it is unopened, intact, and unexpired. I'm going to take all of my items here. I'm going to head to my quiet area and gather all my supplies. In my quiet area, I'm going to make sure that I look in my drug reference book and make sure that there are no contraindications with any of my medications. That one, that one, and there are no contraindications. I'm going to grab a couple alcohol swabs here. I'm giving milliliters. So I'm going to look at my syringes, and this is going to be intramuscularly. Intramuscular, I'm going to need a 23 gauge syringe. And then for my insulin, I am always going to use an insulin syringe. And then I've got my cup for my oral tablet. Okay, I'm going to go through here. I'm going to do my second med check here in my quiet space. I have got Liam Williams, date of birth 2/24/XXXX. MR number is 002 47 1258. We have no known drug allergies. We have today's date is 3/22. And then we are giving today medications that have not been given yet. We have the influenza vaccine. Influenza vaccine 0.5 milliliters I am right now. So I'm going to do some med math while I am here. 0.5 milliliters over one dose. And I've got my dose, and this is 0.05 over one dose. Those cancel each other out, and so we're just getting 0.5 milliliters per dose. Okay, then we have oxycodone, OxyContin. I have OxyContin right here, 10 milligrams extended release. I have a 10 milligram extended release tablet, unopened, unexpired. Release expires 12/31, and it is intact. I'm going to make sure this is a 10 milligram per dose. 10 milligram dose in my hand. So I just have one tablet here. All right, and then my third medication. I have insulin, Novolog insulin. I have that right here, 100 units per milliliter. And so his blood sugar in report this morning was 176. 176 on my sliding scale is 2 units. So you see 131 to 180 is going to be 2 units. Okay. So while I'm here, I'm going to put on gloves. I have my insulin, 100 units, expires 12/30/2050. It is unopened, unexpired, all intact. I'm going to scrub the hub very vigorously for 15 seconds. Put my insulin shot here, get all my things prepared. I'm going to draw back two units here. There's 5. Just 2. I'm going to lift the lid there so I can see correctly. 1, 2. Okay. And then I'm going to inject that into our insulin, and I'm going to draw out 2 units. There's quite the bubble in there. All right, and I'm going to one hand scoop this, get that on there. If you want to try to double check under that, I would get a nurse's second opinion on checking my insulin injection as well. We
lift the tab a little bit. Okay. I confirm that that is 2 units.
Thank you. All All right, I am going to label. I'm getting two units. I've got Novolog. I'm going to put my name, the date, and my initials. Make sure I've got that around there. All right. And then I'm going to go back through one more time and make sure I'm doing my med math on all of my medications correctly. So I'm going to throw this away. Okay, so I'm going to start here. I've got 0.5 influenza vaccine, so I might as well just go ahead and draw that up as well and check myself. I'm going to draw back 0.05, and on here I have 0.5 is one dose, and then one dose is 0.5 milliliters. Those cross each other out, so I am left with 0.5 milliliters. I have a 1 milliliter syringe here, and so I'm going to draw it back to draw back air to 0.5 here. See that? This is close to that there. All right, so I've got it drawn back. I'm going to scrub vigorously for 15 seconds here. Inner to outer, drop that lid, and I'm going to insert my air into the vial. Turn it upside down, and I'm going to draw out 0.5. Okay, I'm gonna give it a little shaky shake there. Got some air bubbles in the top. I'm gonna draw out just a little bit more so I can get those air bubbles out at the top. Got a big stubborn one here. There we go. There we go. Perfect. I'm going to one scoop my lid back on. Whoop. And I'm going to label this one as well. This is going to be my flu vaccine. So we have got inactivated influenza vaccine flu zone. We have 0.5 milliliters. We are giving that today. 3/22/22, my initials, and then I also like to put where it's going to and how much. There we go. All right, I have done my first and second mid-math check. I have scrubbed my home. I'm going to clean up my materials here. That is yours. Put a couple alcohol swabs in my pocket. And then my last med check is going to be for my oral medication. I have 10 milligrams extended release. I've got 10 milligrams per 1 dose tablet. I have oxycodone, oxycontin, 10 milligram tablet. Expires 12/31/60. So I'll have all of my medication. It has got all of my materials together. And throw that away. I'm going to take all of my medications into my patient's room. Let's see who's under the covers. Here. All right.
Hi, come in.
Hi, Mr. Williams. My name is Jenny, and I'm your student nurse today. I've got a couple prescription, I've got an injection, a couple medications to give you. Would that be okay?
Yes, that's fine.
All right. I'm looking around the room here. All the bed rails are good. I'm going to provide you some privacy, okay? All right. I have your flu shot, your insulin, and your OxyContin for pain. Are you in any pain right now?
Yes.
Okay. Can you tell me your name and date of birth, please?
Yes. My name is Liam Williams. My date of birth is 2/24/XXX.
Great. Do you have any allergies?
I do not have any allergies.
All right. That is good. I'm going to go in here. How are you feeling today?
I'm feeling okay. I'm just in some pain.
All right. Does your pain, how would you rate it on a scale of 1 to 10?
I'd say it's about a 7 right now.
Oh, all right. Do you know where you are this morning?
I'm at UK Hospital.
All right. And what day of the week is it?
It is a Tuesday.
Okay. Good job. Patient is alert and oriented ×4. Does anything seem to make your pain better?
Definitely my medication.
Awesome. Well, we will get that taken care of for you. Okay. I'm just going to look at your wristband here. I have got Liam Williams. Liam Williams. Date of birth 2/24/XXX. 2/24/XXX. MR number is 002-47-1258. Perfect. And today's date is 3/22/22. I have got your flu vaccine, 0.5 milliliters. I've got that one right here. Flu vaccine, 0.5 milliliters. It has not been given yet, so I'm going to go ahead and do that now. And then I've got, next I have your insulin. Your blood sugar was 176 this morning. So I'm going to give you two units of insulin. And then I also have your oxycodone, 10 milligrams extended release, to give you that right now as well. And it doesn't look like any of that has been given. So I'm going to go ahead and do that. All right. Do you want these in any particular order?
Whatever is fine. It is up to you, ma'am.
Okay. Well, if you don't care to turn over to your side a little bit, I'm going to go ahead and start with your flu vaccine first. And I'm just going to give it kind of in your bottom area, okay? I'm going to turn you to this side. I'm going to turn you to the side. And I am giving it in the ventral gluteal. So I am going to put my hand here and have my thumb or one finger pointing towards the spine, and then my other finger pointing towards the iliac crest. And I'm going to find right underneath of here in the ventral gluteal. So I've got my medicine injection here. I'm going to clean your site real fast. Scrub from the inside out. We're going to let that dry. Okay, I'm going to pull back Z-track. Insert, stabilize, and inject. All right, I'm going to cover up here and pop that. All right. Do you feel all right?
Yes, I feel fine.
Any pain or irritation there?
No, ma'am.
All right, good deal. You throw this one away and we'll move on to your next one. Okay. Next, I'm going to give your insulin shot. And I was not, it looked like when I was doing your assessment earlier today, I was not able, you're pretty thin, so I'm not able to pull up a whole lot. Is there an area where they went around your belly last time for your insulin? Didn't say. Okay, so we'll just go in a different area this time, all right?
Okay, sounds good.
I'm going to scrub from the inner to outer. And a good subcutaneous location for insulin that you always go in at 90 degrees is around the navel, 2 inches around. So I'm going to go about 5 o'clock here. I couldn't pinch. And then inject, stabilize, and then insert. All right. Okay, was that all right?
Yes, that was fine.
Okay, good deal. Cover you back up here. You're doing great. Okay, are you ready for your pain med?
Yes, ma'am.
Okay, would you mind to take a little sip of water for me? Great job. Let me look in here, see if you have any sores or lesions or any redness. You feel like you're swallowing okay?
Yes, ma'am.
It
No
looks
problems.
like you did a really great job. Open this, unopened, unexpired. Put it in here. All right. You swallow that for me?
Yes, I did.
Great job. Okay, how are you feeling?
I'm okay right now. I'm sure I'll feel better when this medicine kicks in.
Awesome. Well, is there anything that I can get for you?
Not right now.
Good. Well, I'll come back and check on you here in a little bit. If you need anything, you just push your call bell. Return your call bell to you here. Push your bedside table close by where you can reach it. All right. And if there's anything that I can get for you, you just push that call bell and I'll be right back in, okay?
Okay, thank
All
you.
right. You have a wonderful day.
You too.